Stop ignoring that back pain. You know that backache you have on one side of your back that feels like somebody is stabbing you. Stop ignoring that pain and see a doctor today. It might not just be an ordinary back pain, but maybe a kidney stone. Now, nephrolithiasis, or kidney stones as it is commonly referred to, is the third most common disorder of the urinary tract, and that tells us how important it is that we need to talk about it. When I say kidney stones, I'm talking about a stone as in a stone that you know. Kidney stones are not to be toyed with. Once you've passed a stone before, you never want to experience that again, because the pain is excruciating. Some people even compare it to the pain of labor. Well, that is a discussion for another day. I actually saw a sort of like a debate where, okay, not a debate anyways, but I saw a post where a man asked his audiences, which were mostly women that had given birth, if they could compare the pain of passing a stone and the pain of labor. So a few of them, though more of them actually, most of them rather, said because they had passed stones before and they had also gone through labor. So most of them actually went with the fact that the pain of passing a stone is more than the pain of labor. Again, that is a debate for another day. But this is just to tell you how painful it is to pass a kidney stone. Now, stones usually form when the urine is highly concentrated. You know, let me give an illustration. So when you have a small bowl of water and you keep adding salt or sugar to it, you keep adding to the point where it becomes concentrated, it becomes saturated and becomes super saturated. Now your sugar or salt no longer dissolves in that water. Rather, what you see is formation of crystals. Like you begin to see those particles, they are no longer dissolving. Now that's what happens when you have concentrated urine. Of course, our kidney is supposed to filter our blood and then excrete waste. It's supposed to reabsorb some fluid and then excrete some and all that. So now when you are not taking enough water or you are not well hydrated, your kidneys produce concentrated urine. So ideally, our kidneys do the work of excretion. So when you have things like calcium, most of it is reabsorbed into the blood and then some of it is excreted. You have things like uric acid, all byproducts of protein metabolism are being excreted. So now these things need a liquid medium where they are being dissolved and excreted, because you know most times we excrete these things in form of urine. But if your liquid intake or water intake is so little that, you know, going back to the illustration I gave, these things dissolve in it, or these things are in it and do not get to dissolve because of the little fluid or little water available, these things will begin to form crystals. So hydration or level of hydration is one of the most, is the most important thing when it comes to stone formation. Also, there are protective mechanisms in the body that would help with that. So they bind some of these things and help to excrete them. But the one most important thing that helps with that is our hydration level or level of fluid intake. Now, there are majorly 4 types of stones. There's the calcium stone, the uric acid stone, struvites, and the cystine stone. Now, these stones all form like calcium, as the name implies. It is as a result of excessive calcium, and then or calcium that is not able to be dissolved properly. There are things that lead to this, or rather there are conditions that lead to, you know, having maybe excess of calcium or having excess of uric acid or having cystine or making struvite stones. So we'll talk about that in a later video. But the sole aim of this video is to advise you to take water, is to let you know that something that may take you to the theater, because depending on the size of the stone, at the end of the day, you may land in a theater to be able to remove the stone. So something that will take you to the theater and then you can prevent it by taking as much water as possible. I mean, isn't that cheaper? So I'm going to mention a few symptoms that will let you know that your backache is most likely a stone you're dealing with. So when you have this one-sided back pain, we call flank pain, it's so excruciating, and then the pain can radiate to your groin area. Also, it's a pain that is throbbing. So it can be like, it may feel like a stab, and it's colicky. That means it comes and goes. So it comes in waves. And this happens because the stone is trying to pass. It's formed within the kidneys, but then every other thing within the kidney is passing through the ureters and then down into the bladder. So the stone may as well want to pass. So because of that, the smooth muscles of the ureters are going to be contracting. While they contract, they are trying to push the stone down. So that pain you feel will come in waves. When it contracts, you feel the pain. Also, you may have hematuria, that is blood in urine. Now, it may be visible, it may not. So it may be microscopic hematuria, which can be picked up when you do a urinalysis or any other test to check for that. But there may be visible blood as well, and this happens because, I mean, the stone is trying to pass, and then especially when it's a big stone, it's going to, imagine you have a tiny pipe, or yes, a tiny pipe, and something is trying to pass through. It will most likely scratch the internal walls of that pipe. So when the stone also scratches the lumen of the ureter, you will see there will be bleeding, and that's what you see as blood in the urine. So when a stone is so big that it's even unable to pass, it can block the ureters, and then there will be backflow of urine to the kidneys, and that will cause hydronephrosis. And then eventually, when urine stays, no excretion, it will result in infection. And when you have infection, you have fever. So you may come down with a fever alongside the pain. There may also be nausea, vomiting, and it can also be asymptomatic. Now, this will depend on the size of the stone you are dealing with. So if it's a small stone, say less than 5 millimeter, because the size or the diameter of the ureters are at least between 3 to 5 mm. So if it's a stone that is less than 5 mm, it means it will pass. Though a stone of around 5 mm may pass with difficulty. That's when you feel the pain. But now a stone that is greater than 5 mm will not even pass. You will feel the pain, and then of course you develop some infections. So yes, it can be asymptomatic based on the size of the stone, that you even pass the stone without knowing you had passed a stone, and then it will come with symptoms when it's a bigger stone. So if you've experienced this, I'd love for you to share with us your experience in the comments, and then in my next video we are going to talk about ways to prevent this happening. I mean, what's the point of talking about it if we can't talk about a prevention method? And I think I started by telling us that hydration. So next time when you see your urine is concentrated deep yellow, you know what to do. You take as much water as is needed, and then our body works magically that it tells you when you are thirsty. But for some of us, we are thirsty but we are busy with other things, so we keep that aside and face whatever it is we are dealing with, and then subsequently we deal with the consequence of not taking water. Some of us, we are pressed, but then we shove that aside, hold in the urine, and try to do whatever we are doing and come back to it later. Of course, sometimes these parts of our body or these organs in our body are not forgiving. So please, next time when there's a signal to drink water, please drink water. When there's a signal to urinate, please go and urinate. And see you in my next video.